One of the big challenges healthcare organizations have is trying to sustain the improvements that they've worked so hard to achieve over the long term.
A lot of organizations are still very silo-based in terms of their infrastructure, in terms of their priorities, in terms of their strategy, and in terms of their tactics.
It's hard to get focused on the right things. And when you're focused on too many priorities, nothing is a priority.
And ideally, you want to deliver safe, high-quality care in an environment where, patients are leaving you, walking away, believing you connected with them, that you actually care for them. That's our challenge. So we don't have a unidimensional silo to focus on. It's not just safety. It has to be all three.
The innovative organizations are thinking about patient experience now broadly. They're thinking about it as safety plus quality plus the experience of care, sitting on a foundation of employee engagement with process improvement wrapped around it.
High reliability in healthcare is doing those things that the patients need and doing them as close to 100% as we can. It's really about execution, it's about consistency, it's about really meeting that promise that we make to patients each and every time.
So high reliability is essentially preventing failure in our processes, in our policies and protocols, in our technology, in our environment of care, but primarily in our people.
So it's practicing the behaviors, the tactics, the methods, every patient, every experience, every time.
The thing that we think is most effective is this idea of using high reliability as an operating system, that it becomes the chassis, the framework, if you will, along which everything else can run.
To get on a pathway to high reliability, it really starts with knowing what you have. Hang on to everything that makes you good today. So create tooling that leaders can use every day, that staff and medical staff can use every day.
It helps to frame up what is most important in the work that we're doing. It's helping people who are fallible by nature to recognize that it's okay to make mistakes, that there's a learning environment that we're fostering. And from that environment, we can grow as individuals and as an organization.
We've had the good fortune to work with a number of organizations over now the past 10 plus years. So the good news is there's a roadmap that takes the theoretical and can turn it into the practical.
Many of these organizations, they're using, one organization for safety improvement. Maybe they're using another organization for improving the experience of care. And we'll work with the clients in bringing all of these various systems and approaches together into one comprehensive reliability improvement program.
We can understand from the data what their knowledge gaps are and where we need to build competency and leader skills. Having those at our fingertips provides us a unique insight that most organizations don't capture when they don't have the data.
And people are surprised. We're not coming at them with some theoretical thought process. We're coming at them with their data as the starting point. And from there, we start to lay the foundation to really how to focus on process and culture to achieve the objective we want, which is to reduce harm.
We're students of high reliability, and we come from outside of healthcare and some from within. I worked in nuclear power. We have people from the aviation community. We have people that did manufacturing, sometimes even robotic manufacturing. But it gives us a lot of power in that we have a lot of diversity and experience having grown up in those high reliability organizations so that we know what it looks like and feels like in practice. Culture transformation takes a long time. It takes longer when we don't work on it. So we should be working on it.
I think what makes healthcare particularly exciting is that people are drawn to it for this higher purpose, and that is, this desire to want to help people. High reliability will help them achieve that ultimate goal that they seek.